clearly, eating disorders are much more common among females. So being a female is a risk factor for developing eating disorders. But we don't actually know how many males have disordered eating or eating disorders because it's hidden more. Children's Hospital does see males with eating disorders. So there are definitely eating disordered males out there. Finding them is the hard thing, I think, because it's harder for guys to ask for help for any kind of problem.
How many places are there in Vancouver to go for help?
We have, actually here on the North Shore, we've got the Be Real Clinic, which is associated with Lionsgate Hospital. And you can get help there for an eating disorder or for disordered eating. So before you get to clinical diagnosis, when you're engaging disordered eating practices, unhealthy images with unhealthy body images, problems with self-esteem around weight and stuff, you can actually get help there as well. So there are other clinics as well, but I would really recommend the Be Real Clinic here in the North Shore.
Approximately how many people out of 10 do they have an eating disorder or disorder?
Don't have a clue, sorry. But it would be much less than 1 in 10, much less.
How many teens a year do you think suffer from really serious eating disorders?
Most people with eating disorders don't get the help they need. So we have people on the North Shore here suffering from eating disorders who actually aren't getting the help they need. They aren't seeing a therapist, they're not seeing a dietitian. We have people who've developed an eating disorder, gone to hospital, and then gone out and continue to have an eating disorder, continue to struggle with it and not get the help they need. So we really actually don't know. Most people don't have an eating disorder, just to be clear about that, right? Most people are finding ways to be comfortable, to be okay with their weight, their body, their size, and everything without engaging in disordered eating practices. But as we talked about in our discussion, a lot of people are engaging in disordered eating practices, and they're at risk, therefore, to moving on and developing an eating disorder.
Do you think eating disorders are more common in high school or university?
Yeah. So eating disorders, Children's Hospital has seen people in very young ages in elementary school, but high school and university level, it really kicks in. Those are real big times for risks of developing eating disorders.
So do you think that's the most common age for eating disorders?
I think so, but I think we're going to find out more in the future about people at older ages engaging in unhealthy eating disorder patterns as well.
Where do you think eating disorders are most common?
That's an excellent question. That brings up the idea, are there cultural considerations in different nations that make it harder to be a woman, to grow up with a healthy view of yourself, have healthy eating habits and such? I think that anywhere you have the media, especially the media giving unrealistic portrayals of women, so that girls and women get the idea that, oh, I should look like that, but it's impossible for me to look like that. That's going to make people at risk for developing eating disorders or having disordered eating behaviors. That would make me think that anywhere you have all these magazines and TV and movie images and on the web images of unrealistic bodies, women who are impossibly thin, who've been airbrushed and all that. So that would be Western Europe, Canada, the United States, and increasingly lots of other countries.
What do you think is the biggest influence for eating disorders in teens?
I think it's teens seeing the people that they idolize.
Oh yeah.
I think it's the media because they always show skinny models and such and all these skinny people, and it makes normal girls feel down on themselves and males, and yeah.
I think it's friends, family, anybody that they look up to.